just a few minutes since we're still missing a committee member, but I'm getting the high sign from our video people that we must start anyway. So, welcome everyone to the business meeting of the City Council's Economic and Community Development Committee. Today is November 4th, 2013. Our committee is composed of Councilman Nathan Schmidt. We are still expecting Councilwoman Michelle De La Isla, and I am Karen Hiller, Councilwoman for District 1 and the chair of the committee. Again, thank you all for coming. I want to lay out briefly what our plan is. If anybody wanted an agenda and didn't get one, there's an agenda and a very simple social services funding worksheet sitting up here on the front desk. You're welcome to have one. Our committee has set up a what at this point is a 5-meeting schedule to review the issue of social services and funding of the social services by the city of Topeka. Our plan includes looking at today to look at simply what are our priorities and what are appropriate services for a city to fund. The following agendas would be one on performance criteria and monitoring. We're doing grants. How are we doing that today, and what are some best practices? Meeting number 3 is set up to look at an application process, look at what others are doing, what we have done, what we could do, and then we've reserved time for meeting number 5. I say all that because the City Council has not addressed this issue in years. We want to spend the right amount of time for it. I'm not sure how fast we will go today, but we're going to get started with our conversation. Those of you who saw the meeting notice know that we've set this session up to be what the City Council calls a work session. We feel like we've got enough material to cover that we didn't want you to count on time for public comment or comments. That said, as we talk amongst ourselves, if you would use your judgment, if it turns out that we've got some misinformation, there's some information that you could give us to make sure we are on the right track in our conversations, please raise your hand and let me know, because we don't want to take your time or ours chasing down a rabbit trail if we've got some misinformation. Again, thank you all for coming. If somehow we do wrap up, we've got a time limit in this room of being done by 5 o'clock. That's another reason I put that caveat out on the work session format. If we decide to break or we finish our business and there's time for public comment at the end, we'll certainly do that. I did just get a message that Councilwoman De La Isla is running late, and it may be a half hour before she's here. So the two of us will get started the best we can and have her pick up.
Sounds good.
Our charge today, again, is to look at the categories that the city has funded in the past and kind of discuss what's appropriate for our funding. I'm hoping that we can stick with broad categories if possible, but up here at the front, we as council members, in terms of handouts today, we've got some detail work on what the city's funding is. They've been grouped into categories which we will either sustain or change. We can go either way. And we also have information about the other major funding sources for social services in town with a 5-year history. We've got the county, we've got the alcohol and drug funding, and we've got United Way, as well as the emergency shelter block grant money and the Shelter Plus Care Services money. So we've got those for reference. If it turns out we need or want something else, why, we can go after that too. We did our best to get 5-year history, not so much to look at item by item, but to be able to see the trending as to whether sources are funding the same thing year after year at about the same amount or whether they are making changes. It's difficult to start without our third person, but I guess we'll go ahead. Thank you, by the way, Mayor, for joining us, and City Manager Colson. And we do have some staff here too, and thank you for being here. Just to get started, Councilman Schmidt, I wondered if you had just some general thoughts about, of your own, or from what you've picked up from the council, or from constituents about what's appropriate or not appropriate for a city to be funding with tax dollars. To kick this off.
Well, I think going through the budget process, there was a lot of information presented on what exactly we do, what these grants go towards, and the kind of services that they provide. I think there was, a lot of support for items that basically extend city services, that organizations that enhance already existing city services, like police, when we're talking about battered women shelters or boys and girls clubs that work with youth development, and also specifically the aging population, services that are going to have to be funded in some way, whether these organizations exist or not, and prioritizing those kinds of issues, if that makes any sense.
Mm-hmm. I think, and really, we're going to have a conversation as this is a committee meeting. So if we go off, really get my attention. My sense is that 2 years ago, if we'd had this discussion then, people were concerned enough about the state of the city's budget as well as the community that, and there was certainly a lot of discussion that social services was something that the city didn't belong in the business from. We should get out of it. Still, essential city services, things that we would have paid for or tried to do in-house, maybe not as well as if we contracted it, were essential. But then looking at aging services, which at one point I think, and somebody can help me here, the county funds hundreds of thousands of dollars of aging services, and the city is funding about $40,000 at this point. I think at one point the city and county had gotten together and decided all that would go over on the county side and the city would do other things. And then because of the compelling nature and popularity of aging services, they crept back in to the city budget, but never in a real big way. So looking at that kind of thing, because they are popular, so they've got a category. But then whether emergency aid programs, school youth programs, after school programs, a lot of people felt those could be funded by the private sector or United Way or other sources like that. I'm sensing from the council that perhaps with us passing this super economic crisis that there is certainly a lot of care in the community, but still a need to review what we're funding and how we're funding it and see what we think is best.
I agree with that. I also think that there's an increased emphasis on accounting for these funding services. I don't think there's a great deal of opposition to any of the services that we fund. There is some question as to how do we come up with the metrics to evaluate the effectiveness of a lot of these programs, and are there better ways to do things? I think part of the process, and during the budget process, the city manager brought this up, the idea of making these things more open, more competitive, so that we have the best, if we're going to allocate public dollars towards these very worthy causes, we want to allocate those as efficiently as possible. We want to allocate them to the organizations that are doing the best job, whether it be aging services or youth services, or any of the services that we advocate for. We want to make sure we come up with a system that defines what we're expecting and defines a way of measuring how they're reaching those accomplishments.
Well, let's go ahead again. Hopefully Michelle will be here soon, but What I'd hope we'd do today is take these contracted city services and go line item by line item in terms of what they do and talk about whether that was essential to the city. And then look at these other brackets, aging, medical, youth, emergency aid, and so on, and talk in general about whether that's something we should be spending city dollars on. Does
Okay,
that work for you?
that works for me.
All right. And city manager, if are insights that you have on any of these services or how it works with staff, please pitch in.
Thank you.
The first on what we have on contracted city services list is, battered persons, police liaison, which today is, YWCA's program. Social service planning and advocacy, that was the short term I used for what CRC is doing for the city. Tenant landlord or fair housing, which is what HCCI does. Beautification and volunteers, Beautification Association, KAB, Keep America Beautiful. Aging Grant Administration, which is JAAA. And then, although I know that changed over the last couple of years because it was grant administration for a long time, and then you got told by staff it couldn't be and had to pick a program, so we'll deal with that. And then neighborhood crime prevention, that being Safe Streets, which doesn't show up in the competitive, if you want to call it that, system or with its own line item, but is definitely an outside grant to an agency. So, and we have our reference material if we need it. In terms of the city funding a program for battered persons. The program meets people, accompanies them when there's an issue, contributes to shelter and counseling programs.
And you're asking,
Whether as a city service, whether that's an essential service or whether the city, let's say we backed out of it, would somebody else do it or pick it up
well, I
to
think,
provide the needs that we have through the police department?
I think that's an essential city service. I would actually like to get more input from, law enforcement,
Okay, we can do that too.
on how effectively we're doing that and how important that is, but that's, I think characterizing that as a contracted city service is an appropriate characterization. This is something that's going to have to be done. I think the city manager has something he might want to say on that.
Oh, I'm sorry, I just want to clarify with you, Councilmember Hiller.
Mm-hmm.
Do you want us to be, when an idea like this is brought forward in terms of gathering more information, just want us to be prepared to bring that back and report at the next meeting, or do you want us to provide that information in advance?
We're kind of working our way through this. Probably what we'll do is, we'll see if there's just one question or whether we have a string of them. Because if we want to readdress the issue of what our priorities are in a second meeting, we'll just kind of need to see whether we've just got one question or whether we have a series. It's very helpful. It's a little challenging right now in that what we want to talk about is the service, not the agency, not the exact services right now. We'll address that kind of process later, but do we need somebody to do that? If we didn't contract it out, would we have to have staff internally because of the need or the demand for service? What would we do? So that it's classified appropriately. What happened is that the agencies on this list worked their way into line items because they were important enough, and it's my description, so somebody can challenge that too. Important enough that people didn't want them in the competitive basket, if you will, of all the other services. Okay, let's just move on to social service planning and advocacy. This particular agency's been involved in assisting really the county more than us in doing their grant making. Got involved in creating the issues like complete streets and anti-obesity, healthy eating and living. that have become part of what we're doing at the city. Get with other agencies, such as on the issues of aging agencies and transportation and services for seniors. Coordinate that sort of thing.
Yeah, I think, well, I mean, that's, I guess I'm struggling with the idea of, I mean, all of these are very valid, you know, city services. The idea of prioritizing these is difficult.
I don't think we have to prioritize within this list in a way we're simply validating whether that subject matter belongs on the list, whether we need somebody to do it, whether it's essential to the city.
Well, I think it is essential to the city.
Okay.
I would definitely keep that on the list.
Okay. The third one is tenant landlord and fair housing. That had emerged even before we dropped the function of enforcing fair housing and equal employment issues at the city level. The angle there being that those were important neighborhood issues, important personal protection issues, and that if there wasn't an agency to contract them to, that people would be here. City attorney's office with consumer division or something like that.
How do you feel about that one?
Well, I've got some history with that one, so, but that's how it developed. That's how that partnership developed, was that it was really essential, dealing with over 1,000 people a year, and the issue is most cities that deal with it, it's very difficult to do that kind of thing with only one person because they need somebody else to consult with. So you need a certain amount of volume to do a good job. And beyond that, then if you've got a specialist, if you can do that with paralegals that are specialists versus paying an attorney twice as much or more and having them stretched amongst a variety of constituent issues, it ended up being more cost effective to do it that way, and there was enough of a demand that we had the volume. So that service has been effective over the years in really raising the bar on landlord-tenant relationships with the handbook and the model lease and so on, so that things are not as bad as they used to be, but there's still plenty of issues and questions.
Yeah, I think the issue with that is that we've somewhat gotten out of the business of fair housing on the city level.
Mm-hmm.
And you know, it's difficult to support that financially while backing away at the same time from the enforcement measure of it. It's obviously, you know, an important service. I'm not sure if it's not better directed at a county level than a city level.
I know that in the past that it went back and forth. It was one of the agencies that got funded by both in the past, and the conclusion was that almost all the rentals, especially the older ones and the ones that were more problematic, were in the city. So that even though the agency helped city and county, it made sense for that one to be funded on the city side. Also, one of the comfort levels that folks had in dropping the fair housing enforcement was that most of those issues were tenant landlord ones. And what you needed to know first was what your rights were and did you handle it right. There were only a handful that were actually fair housing issues. They were mostly housing issues that people were struggling with. They tended to work together on those, and so part of the comfort was that if HCCI was still there, that actual fair housing component could be taken care of if needed at the state, but at least the housing issues would be covered.
Well, and I think, you know, I mean, I'm fine with leaving it in the, you know, in this category. I think the discussion, and this is a discussion for another day, comes with, you know, since we're not in the business of enforcement, it comes with, you know, the discussion is what is our level of involvement. Some level is appropriate, I think. What is our level of involvement, and what are the metrics that we're going to use to, to judge that and to evaluate, our continued participation in that. But I think it's fine to keep in the list of contracted city services.
Okay. The next one is beautification and volunteers. And Keep America Beautiful does projects all over town.
Mm-hmm. They do a
with
great job.
Literally thousands of volunteers. And one of their most recent projects was doing the front steps of Topeka,
Well,
our property.
I think this is an easy one. It's a, fairly inexpensive item as far as what we put city money into, and they do a great job, and they do that job with very little hand-holding. I mean, we assign them the duties, and they go about and do a fine job in the community.
Okay. Aging Grant Administration. I think we're giving JAAA about $15,000. That's just one agency. That's because they're the umbrella agency over all the aging grants.
Mhm.
I really, because of that, that's why it was line itemed in the past. It's kind of toggled back and forth. Could be considered in terms of whether we should be funding aging at all. On the other hand, it again was there because it was at least a city contribution into making sure that that master agency was here to then funnel the substantial amount of money that they bring into the community.
I agree,
So-
and that's similar to, to what we do with the Keep America Beautiful, in that it's really not that large of a line item expense for us, and they do a phenomenal job. I don't think there's many people in Topeka who are either over the age of 50 or know people over the age of 50 who don't have some sort of contact with JAAA and the services that they provide. So I think that one's an easy call.
You didn't say 50, did you? You meant a whole lot more than that.
They have
I'm gonna-
exercise
oh.
classes in the basement, Jim.
They do Tai Chi or Taekwondo too, I think.
Something, Jocelyn's in the back. Tai Chi, she said.
Tai Chi.
It'll change.
Neighborhood crime prevention, that's Safe Streets. Affiliated with the police department at this point.
It's funded through the police department as well, right?
Yes.
Through the police budget. I think that's a worthy contracted city service, the police department, because they fund it through their budget and they advocate for it through their budget. Seems to believe so as well. So I think that one's certainly located in the right spot.
Something they did that we didn't really have a service to do until they started it was organizing, working with neighborhoods for neighborhood organizing as well as the neighborhood watch. We're dealing with that at the housing and neighborhood development side now in terms of supporting the neighborhood associations. And so that's been a real essential service that may be underused or need more of.
I think they're also the primary coordinator of the National Night Out program,
Absolutely.
correct? Which they do a great job with.
It's true. and if
Which
we
gets
want-
bigger every year, I think, too.
Well, and for city spirit and city commitment to,
Mm-hmm.
okay.
And city involvement in, what the police department, what law enforcement does.
Well, were there any others, and we can always go back to this can be a moving page, that you thought should be on this list? didn't get on it in
I-
this.
No, I don't
iteration.
have any others.
Okay.
I think this was fine.
Okay. Well, with that, let's move on to aging services. We actually fund, I think it's worth it to put that one in some perspective. Let me see if I can grab the numbers real fast. We are funding about, well, $42,000 across 4 agencies this year. If you look over on the first page of the Shawnee County packet,
Mhm.
they are funding $621,000 worth of senior services this year through the county side.
Which they're reducing
And
significantly
they are
next year.
reducing that by 80,000 this year. And those recommendations have been made by a citizen panel, but they've not been to the county commission yet, and people weren't sure it would be appropriate to release them here, so we didn't. But you can see the pattern in that they've been fairly steady. Again, I don't, I don't remember what year, and I may be a little bit wrong, but I think at some point, maybe 10 years ago, Nancy, the city and county did this kind of process together. Actually, it was coordinated by CRC, and decision was made to fund all the aging services through the county, pretty much?
I believe so, and the reason was because we have the two out, we have three, Auburn, Silver Lake, and Rossville. And if the city funded them, they would only be the city agency. If the county funded them, then they could include all three of them.
And I think also there are services that are countywide in addition to the
Yes.
centers.
That, $520,000 this year is not just for the 3 seniors, or the 6 senior centers.
Right.
It includes, Community Action, Kansas Children's Kansas Legal, I'm sorry, I don't remember the.
Kansas Legal Services, American Red Cross Transportation, Catholic
Actually,
Charities.
they're out now.
That's right, they're out,
Because they're not, they
Yep.
don't provide transportation anymore.
right. Vallejo,
Yes.
services for seniors.
Actually, part of them have dropped out because they're doing less and less services also.
Okay, thank you. Anyway, just for proportion, the county is doing a substantial amount, and those were the reasons. There is also, and I may drag Jocelyn up here, but there is also a shift. There's been some concern about the senior centers and the level of participation, as well as the use of their transportation and duplication of the transportation.
Mhm.
My understanding is that the senior centers, the 4 in the city anyway, are under 3 in the city, are under direction from JAAA to have a consolidated transportation plan in place by October of 2014.
And Termine can, Jocelyn and I have both been on the committee, CRC has chaired that committee, we've met for 4 years now.
Yes.
And, the senior centers have come back with a plan now.
Already?
Yes, they
Okay.
have, and we are having a meeting on the 18th with Jocelyn, and then Scott Lean from the state of Kansas called me today, and would like to be involved in that meeting for possible funding from the state. We are talking with Topeka Transit to see where they might fit into this whole thing too. They are only looking at medical transportation, not your day-to-day transportation. So that amount, they are looking at dispatching only. So, we have copies of their plan that I would be glad to get to you all. I think that we can get that to them, can we not? Just, yeah, we'll be glad to get that to you. It has not been, Jocelyn, JAAA is the one that does have to sign off on it because, and I can't talk to Jocelyn except I know that the reason we were on such a tight schedule here was because their organization board of directors said they would cut their funding off if there was not some kind of, consolidated dispatching. Did I say that right? Now it's Jocelyn's on the show.
Thank you. Our board actually had, with the next fiscal year, and looking in terms of fiscal year 15 that begins in October, they had stated that transportation services would not be funded unless they were in a central dispatch system. So it was any transportation program within Shawnee County or Douglas County that we were to fund, they must be in a central dispatch system.
Thank you. No, we're not gonna be making specific grants today, but the fact that the aging services, particularly the ones that we've been involved with, are very much in transition, is worth addressing, it seemed. What has happened when, in terms of the grant considerations for the senior services as they've changed at the county level, is that there's been a citizen group advised by CRC that's gone through the proposals in their specifics and has been aware of things like we just talked about.
Actually, Madam Chairman, the Shawnee County Advocacy Council on Aging is appointed by the county, and from that committee, the grant review committee is set up, and they are the ones that come in and make the recommendations back to the Shawnee County Advocacy Council on Aging, SCACA. And they meet monthly, the first Wednesday of every month at 9:15 at JAAA. But they are appointed by district through the county commission.
Thank you. And what's been happening with the city is they've just sort of looked at what they funded last year and did it again or cut it or something like that without much discussion. So again, we can talk about process later, but if and everyone thinks aging services are really important, there's no doubt about that. The issue would be whether that's a good place, and I'm not taking a position on it, for the city dollars to go and to duplicate a funding process and a decision-making process.
Well, I think, and we're going to get into this, more in coming meetings, with how we evaluate the process. But yeah, I mean, it's a critical process, and it's a critical service that is provided. I think there has been a question, and it's obviously being addressed by the organizations involved, of overlap and inefficiency, particularly in things like transportation. And I've heard no objection from them to, making the process better, which I think, this entire process of prioritizing things and again, we're gonna get into this in more detail in further meetings, but this idea of accountability, and performance measures, I think is going to be welcome in that area. And I think we'll make it a better service.
Welcome. Thank you. Councilwoman De La Isla has joined us. We have made a first run through the issue of the line item to contracted city services, and we're talking about aging. Maybe we can get you the notes and pass the end of the meeting, catch you up on the beginning. I'm sorry you had to be late. We're talking about the aging services right now. You're a pretty quick study, but I don't know how much you picked up coming in the door. Do you have some thoughts about their priorities, the priority of funding them as a city, and or with the county picking up most of that freight and having a process for them?
You see, I for
Thoughts?
one, have very strong feelings with regards to funding for the aging. Number one, a lot of our constituency is an aging population. For a lot of people that do not understand the way that our community is divided and the way that it's structured, we hold two major regional centers, which in turn end up bringing an elderly population to come back to our city. A lot of the people that are traveling from outlying communities end up relocating to Topeka. We are home of places such as Brewster Place, McCrite, We have Plaza West and others to mention, Pappin's Landing, LULAC Senior Center, that are all providing essential services to our seniors. I think that, at least in my estimation, I do understand that there is redundancy, and that there has to be something done with regards to the redundancy that we have in the services being provided in the area of senior services. However, senior services, to me personally, is a priority that as a city that we should be looking at very seriously.
Okay. Further comments at this point on this? It is a challenge all the way through for us to look at what's a priority and then whether it needs city dollars, both from whether it needs it or whether from our point of view, whether those dollars are available. So we'll continue to address that. Okay, well then let's move on to youth and social services. We fund a total of 16, 19, 20, 21 programs through our general fund and community development block grant funding, or at least we will for 2014. Just for concept purposes and discussion purposes today, those are in some general categories in terms of whether those categories themselves are appropriate and or a priority in your opinion for city funding. Obviously, this committee would then report to the council. So this is committee discussion, again, with the sense of what you think the sense of the council is, the public. First one would be medical. And in terms of the medical, if you want to look at the, Jenny, do we have a marked which are which on any of these documents? Yes, we do.
Yes.
There is a spreadsheet toward the back of your city packet if making reference to what we're funding is helpful. The agencies that we're funding for medical right now are Marion Clinic, Topeka AIDS Project, Project Health Access, and Successful Connections. Would have been ahead of that one.
I think I got it over here. One of these. There we go.
Mm-hmm. So, city tax dollars, medical services for low-income individuals. Thoughts about that? Anything? Sure.
I'm fine with that category. You know, we've gone through most of this. Obviously, all these categories are things that we've already agreed to as a council fund.
But we've agreed to pretty much by default for the last few years without resetting, which is, I think, our charge to say, should we be in this business? So.
Well, I think, you know, none of us would like to be, it'd be great if we were all healthy and we didn't have to fund these things, but that's not a reality of, you know, where we live or how we live. So well, I think they are a priority. I think they certainly deserve consideration.
Okay. Michelle?
I tend to agree with Nathan. I think that two of the big priorities that we should have in our city are medical, and I'll even add to that mental health. A lot of the services that you end up seeing in corrections and with the crime rates that affect public policy are related to medical care that would also fall under medical health. So it would be a wise investment that would then in turn help us with our public safety issues.
Good points. Any other conversation on that one? Youth. The youth programs that we're funding right now include Big Brothers Big Sisters, Boys and Girls Club, CASA, Court-Appointed Special Advocate, Community Actions Project Attention, Community Action, no, just one, Family Resource Center at KCSL, Topeka Daycare's Parent-Child Learning Center program, youth projects, youth court, jobs for young adults, and the YWCA's teen pregnancy program. Thoughts about how important these programs are and the appropriateness of city tax dollars funding them?
Well, I think this is probably the category that, of all the categories that we have, that's going to give us the greatest return. Not that that's necessarily, a way to evaluate who we're providing grants to or who we're, helping fund. But these are the kind of services that, the way they were funded 10 years ago, we're reaping the benefits of those today in terms of, contributing citizens, lower, crime rates, lower dependence, all of those things. This one's a fairly easy one for me because I think, the idea of mentorship programs like Big Brothers and Big Sisters, Boys and Girls Clubs, parent-child learning centers, those are all things. This isn't a cost. This is preventing costs in the future. So this is a high priority for me.
Okay. Michelle?
You see, here is where I become conflicted, because when you look at the amount of allocation that each of the organizations are receiving, it really does not talk to you about the impact that we're really having in this area. And here is where funding significantly to an organization where we feel our focus as a city should be is one of the things that we should look at. Out of the $125,000, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 recipients, which means that none of these recipients is receiving a significant portion to be able to help them make a significant impact in their mission. And it's not that I don't believe in the youth services, because very much like Nathan, I am a huge youth advocate. Founded a mentorship program here in Topeka for Hispanic girls. I mean, I understand the need for mentorship programs and for youth development, because you are correct, Nathan, it is an investment. But where as a city do we want to invest our dollars to make a big impact? Where do we feel that as a city we have a greater need that we should be investing these dollars, rather than putting an organization through the burden of writing a grant for $6,000 that may not be able to give a significant impact back to the community? It's a shotgun approach rather than an impact-related approach.
Well, I think that's a valid criticism. I think that's probably something that we're going to get into more when we start doing, the process, and that's when we'll probably get a lot more angry people of how to do that. I agree. It's, part of the problem is that we haven't addressed this grant funding in the right way in the past. And you're right, it is a shotgun approach, and it's a shotgun approach largely because, all of these are worthy organizations, and they come to us and we want to help all of them. And that's why I think it's important, and, as we, talked about, this is going to be something that we're going to get into more detail in the future. It's important to decide where can we get the most money. If we're giving $10,000 to everybody, we want to maybe we give 30,000.
Correct.
And get more impact for our money. But I think as far as the category, it's a critical category.
I wholeheartedly agree.
And I think it's of the highest priority.
Okay, good discussion. There was a hand from someone to clarify something for us.
Yeah, I just wanted to clarify, the YWCA does not have a teen pregnancy prevention program anymore. It's Girls on the Run now. I don't know if that's important. Probably.
Sure is. Thank you. So maybe it's the same line item we've had in the past, but when we did the 5-year tracking, it may have morphed. All right, thank you.
That's what I was gonna.
Okay, thank you. All right, well, some clarification, and we are going to talk about performance criteria in future sessions, as well as how we would do that funding process. So Emergency aid. Important to fund, important for city dollars to fund. This is cash grants to individuals. We're currently funding just Doorstep and Let's Help.
My question with this line item would be, how many other organizations are providing the same sort of emergency aid services? Like, for example, I know that Doorstep, United Way, Community Resource Council, and everybody, I think the Rescue Mission is one of them. There's a lot of organizations in the community that are providing and receiving funding, federal funding actually, to be able to provide this service. So if there's federal funding coming in large amounts to the community, even though that the pool may not be, of course, there's a greater need. Is this something that then the city should be looking at funding? I'm not saying that it's not important, but I'm just saying that understanding that there is a large pool of federal funds that go to different organizations throughout the community. Is this something that we can look at?
Well, and just to add to that, and I'll turn it to Nate, there's also a lot of private money.
Correct.
People donate food, clothing, cash for such services. Nathan? Thoughts?
I agree that it's not, you know, there are a lot of sources for emergency aid funding. We also, and this is again more in the process realm, but you know, we provide $38,000. I think if you look at Let's Help and Doorstep, you know, we're getting a pretty good return on that. It's not a major line item, even within a lot of the social service funding. I think it is important. I think, you know, federal funding and even state funding, those are nice, but it's nice to have at least some local input on this, because these a lot of times are unique situations that people find themselves in because of, you know, circumstances that may not play into account on a federal level. It's something that, you know, if we have a major corporation that shuts down, or we have, you know, something local that happens, and we find a surge of people that are in need of this, I think that is something that a city has to have at least some investment in. So I do think it's a priority, or I do think it should remain in the, you know, in the list of priorities.
Something we may want to double check, and I'm seeing a hand back here, but I don't know how much federal money is involved in, except for rent assistance.
I think those are and I'm,
Go ahead.
well, the CDBG funding, that's what's confusing me. If you're talking about city dollars, and I was asking Rochelle if those agencies would get CDBG money, which is federal dollars. I know they come through the city, but we've got we're CDBG, which I think is all federal, so I just don't want people to get confused.
CDBG is federal. We have grouped them together here.
The Doorstep and Let's Help is federal.
So that's federal.
Okay.
I just don't want my listeners to get confused that it sounds like we're talking about city dollars, but it's really federal dollars. Does that make sense?
That's fine. I mean, one of the things that we face is that we put them together in the social service block grant, and and there are lots of things that are funded with city dollars that could be funded with those federal dollars if, you know, those are all choices.
Yeah, it's
That-
still
Yeah, good point. Overall, though, we might, if it helps to understand where that money is coming from right now, Jim has stepped out for a minute, but maybe we can get some information about, in the whole aggregate of emergency aid money, which of course, even we can talk all we want about how it's split up, but they're always out. Everybody else doesn't get any because they're out. But, so there's maybe never could be enough, I don't know. But maybe we can find out where it's really the money that's actually given out to pay people's utilities and so on. And Jenny, maybe split it between the quote emergency aid and the medical, because we've got medical in a different line for where people are getting pharmacies, assistance and so on. So we've got our apples and oranges separated. Nancy?
Madam Chairman, that's the beautiful part about Mac Lake.
Okay.
Because if you do get federal funding, especially with the continuum care, you have to be on Mac Link. so we can track that for you. And what we are working with the providers right now is, what are your protocol for this particular, I mean, there are different funds of money.
Mhm.
So, but like one of the unwritten rules with a food basket is, if you go to Let's Help, which is on MacLink, 60 days, you cannot go to another MacLink agency for 60 days and get another food basket. That's why we have a whole bunch of agencies that are not on MacLink, because they become our safety net now. But we can get you exactly what the utility, how many utilities we're working on, how many, I mean, Rochelle and I have been starting to spend hours on this, looking at one place that people might be able to go to just look at that, to get a certain protocol set up so that the agency is not so beriddled with 10,000, and you're right, I mean, at the beginning of the month, every Tom, Dick, and Harry that needs help calls them, and they are out of money within 3 hours.
Right.
So, but that is a trackable thing with MacLink.
Well, and I remember years ago, Community Action used to be the big, quote, emergency center in
Right.
town, and there was, not sponsored by the city, but a sort of a conclave of everybody who said, gosh, we're spending more money staffing all these places just to tell people they don't have any money, and maybe we could consolidate and have more money available to give out. I don't know if there's been any, so Community Action gave up the emergency center and it became just Let's Help and Doorstep and some of the smaller agencies at the time.
Doorstep, Let's Help, and Salvation Army.
Mm-hmm. Have there been any conversations about doing that again?
Yes, we're having conversations right now about doing one-stop shop. The problem is that, and Rochelle, is that you have this pot of money, you have this pot of money, you have this pot of
Absolutely.
money says you can have utilities every 60 days, this pot of money says you can only have it once a year, this pot of money says, so it's not as easy as just walking in and saying, and some are income eligible, some are not income eligible.
Right.
Some, say you have to have a dog, others say you don't have to have a dog. I mean, there's
Understood.
complicated as that. I mean, I'm being serious, aren't I, Rochelle?
Yeah.
Some of them are extremely complicated.
The Earth Emergency Solutions money, there's a checklist of things that they have to have before they can even qualify at all. So if they're missing one thing, Red's not gonna like that when they come out of our file, so they have to, there's a big qualification process that they have to go through. So I'm saying that it's not that there is not money, it's that they don't qualify.
When we handed out utility money last year or 2 years ago at the city, we had rent money, and we had made great big signs, you have to have this in order to get this rent money. And we still had people that showed up without certain, so they were immediately sent back to get additional things. So it's a real education of the community.
There's a big screening process in most of the agencies are working on over the phone before they even get there for the phone. That's taking us down time.
Mm-hmm. Well, and then there's always the list that everybody's got in their back pocket of the individuals or small organizations or churches.
Right.
So if somebody has a great need, in somebody's opinion, they can still fish around and see if they can find them some help.
And Sherman, we'll get you a report for, this is November, we'll get you a report for October, all from MacLink, and send it to Jenny for distribution so you can kind of see where the money's kind of gone.
Well, I think that, help me committee, part of the issue is where is it coming from?
Oh, we can tell you
Which
that,
is,
too.
and you've got it for MacLink, for everybody that's a member of MacLink. Is there anything that you've got that would at least do some ballparking on what else is out there outside the MacLink network?
Well, I have a list of, at least for the food agencies.
Uh-huh.
The first page is a list of all the MacLink agencies, and there's about 4 pages of other agencies that are not
That's in our
MacLink.
resource directory too. So.
Want to overdo it. We're trying to look
Yeah.
big picture at this, but the issue would be where, is it appropriate for city dollars to go to that purpose, and is it needed? In any of these, probably everything we talk about is worthy, but you sort of divvy up where your money goes, just like everybody else does, and you look at whether those entities have other sources that they can tap.
And I think all the have other sources, but they do have the tendency to send them to the safety net people, so that they're not using up all those particular resources.
Thank you. So, back to our conversation. Michelle, you were commenting that there are a lot of organizations, a lot of federal funding. My note says have a lot of sources, but, so where are we on this? And with this, no final decisions, I just want to make sure we've got stuff on the table.
I think it's, and I don't remember who brought it up, but it's correct that, you know, the CDBG money, you know, is largely a federal source, but it's city directed. And, you know, I feel it's important to have a city voice in, you know, in that allocation, and to have a city presence in that. So I think it remains a priority. I'm not sure, you know, right now it's not a major, it doesn't receive a whole lot of funding, city directed funding.
11%.
11%.
11%. That's what I was doing just now.
Of the youth and social services?
Mm-hmm. Right now, as it stands, we have 36% going to youth, 32% going to medical, 12% going to mental health, 11% going to emergency aid, 3% going to daycare, and 4% going to Spanish speaking. So it seems that the way that it looked in the past, it was 4th place out of the categories that we have here.
Mm-hmm. 4th out of the 6.
Mm-hmm.
Okay, thank you for that. Mental health, and this one in our chart is mental health / neighborhood, because those have been very much targeted toward persons with severe and persistent mental illness that live in the neighborhoods, as I understand it. Breakthrough's Payee program, Breakthrough's Clubhouse program, and their residential program. And I believe those are all, well, some of them are split, but mostly CDBG.
Yeah, I think it's all,
I think you've got one that's split. No? You're right. Well, you heard that for the next meeting. I hope so. We've tried to streamline the process, and we'll get back to that. Mental health neighborhood, important for city dollars.
One of the reasons that I feel that this is so important for the city of Topeka is for just history purposes. We were home of Meningers, and we were home of the state hospital. And one of the reasons that we have such high incidence of crime is because the system broke. And when the system broke, a lot of the people that were living in these places were released out into the community. So a lot of people that need a lot of the support that they're not receiving any longer from mental institutions such as the state hospital, Meningers, and that is part of our culture. I really feel that there is a high need for mental health services in this community. And I strongly feel that based on our demographic, not because of my personal feelings, this is an important one.
Appreciate that. Nathan, thoughts?
I agree. It's an important one, and it's one that you know, is in the news quite a bit. It's the, you know, and however you fall on, you know, on the ideas and the debates around a lot of the violent shootings and a lot of the violence that's happened here, the neglected portion of that is the mental health, you know, the mental health aspect of it, and the fact that, you know, as a state and as a nation, we've reduced our emphasis on making sure, you know, in this city is a prime example of that. We've lost a lot of mental health resources over the years, and yes, I think it is a priority that should remain.
Okay. Hang on just a second. Next one is daycare. We're funding just one center. Somebody here from daycare? We can check real quick. It's just a single center. I'm not sure I recall which one it is.
Speak of daycare.
I know, but which center?
I think by BA.
Yeah, they've got different locations. Oh, we've got it in here someplace. Jenny, can you?
I think that.
I'm not sure it's critical for us to know at this moment unless it's service or neighborhood based. I don't think it's the one at Highland Park High School.
Is it as Pappers?
I don't think so.
Okay, I
Maybe I can find it real fast.
Just yeah, for conversation purposes, when we're
Uh-huh.
looking for that, I think that it's important for us to know, as a person that has children in daycare, the going rate for daycare is $125 a week if your child is not a newborn anymore. And the amount that we have allocated here is enough for one person to have 109 weeks of care. So therefore, that really is two people that are receiving daycare services.
The parent-child learning centers at Holland Park.
Yeah, but we've got that one under youth, and that was our choice because it was supporting the teenage parents as much as the babies. And so we've got, again, that can change, committee members. It looks like it's not tied to any particular center. Is that right, Jenny? Is that what you saw?
I'm just looking at the program.
Oh, they've listed the Crestview Learning Center and the Little Explorers one at Trinity Church as the two. So, Councilwoman De La Isla points out that's the equivalent of enough for 2 children for a year,
Correct. 109 weeks.
or, subsidizing some proportion amount. Question is, should the city be in the business of daycare? Just as daycare. Again, we put the other one under youth, that can move, but
Number one, I don't feel that our allocation, if we wanted to be in the business of daycare, our allocation does not reflect that.
Mhm.
Number two, this is very difficult because I know how difficult it is for parents to keep their jobs and have daycare. But the question here is, where do we put our silly dollars to be effective? And if we're only funding the equivalent of 2 children, what message are we sending?
Well, and on this one, daycare is obviously a worthy exercise, but I would be okay with combining daycare and youth services, so that, if we're only taking $14,000 and allocating it to daycare, why don't we roll that in with youth services? To the effect that now we have, as we set up these metrics in this process, to gain more efficiency and more effective control, or more effective results out of these grants. If you roll that into, if people can provide us with a reliable statement as to how worthy this is, then they can compete with the youth services for those monies. I think it would be a better way to categorize it, rather than to just say we're in the business of daycare, to say we're in the business of youth services, and daycare can be a part of that if daycare can show an effective use of that money. That's just an idea that I thought of when I was looking at that.
well, that's good. I mean, right now, of course, these categories were for discussion purposes
Mhm.
today because we put all of those agencies in one youth and social services pot, if you will, all together. So kind of a non-issue.
Madam Chair,
Yes.
can I make a statement about daycare and early learning? Because I agree, to fund 2 spots equivalent with 1 agency does not give you any kind of result or
Mhm.
outcome. However, there's a major movement for improving quality care, and to take, what is it, $14,000 for a year, and look at investing it in an organization that improves the quality of care across the board, you really truly look at your outcomes. So maybe daycare is the wrong term. If you wanna look at something like early learning, there are some agencies that really could benefit from that kind of money who can make an impact across the board. And I would think that that is a priority when you look at wanting to break out youth and young children between 0 and 3, you can really have an impact with that kind of money. Just looking at what Child Care Aware offers, for example, or the VOTEC in terms of their early learning programs. There are some really significant programs out there that could benefit from that kind of money.
Thank you for that input. Appreciate it. Any reactions? No, that's part-
I agree. I guess that would be another way to do it. A recategorization of daycare services, you know, early childhood development, those kinds of things I think are critical. Do they belong with youth services? I'm not sure, but I would be okay with broadening that category.
That may be the best way to leave it. Thoughts on your part still?
I just go back to saying, let's look at what social service organizations we have that have a high focus on early childhood education. And there are large groups, and I will say that the United Way has made it a sole focus, a huge focus, I wouldn't say sole, but a very big focus to focus on early childhood education. Most of their advocacy is going into that. So I'm not saying that we shouldn't fund it, I'm saying that let's look at the fact that this is one of the areas that we know that there is strong advocacy for this and strong fundraising going on to ensure that we are successful in the community. If we have already an organization that is highly invested in this, let's not duplicate efforts. And then invest the dollars that we do have to be more effective. But,
Well, and I think that's a way you could do that if we broaden that category to early childhood development services, which may or may not include daycare services. You know, by doing that, that gives us the ability to, you know, instead of having to fund daycare services, maybe in the future that's something that we do need to fund. Maybe it isn't something that we fund now. But if we broaden that category, it'll give us the flexibility, you know, to look at those issues and for, you know, organizations to present, you know, the best return on that investment.
Well, and you both are touching on, you know, what's emerging today is a sense that all of these categories are very important, and an understanding on the part of you all as council members of that. And so if in fact the process, the application process and the assessment of the value of the investment of the dollars in each of those particular programs is more important, we'll see. And you bring up, I'm just kind of laying the groundwork for some future discussions, a point in that if United Way is really heavily invested, this is just conversation, but really heavily invested and therefore knowledgeable, has staff and volunteers who are very knowledgeable, who are making good decisions on where to direct those dollars, not only in terms of duplicating dollars, but we haven't figured out whether we're gonna recommend a better way for the council to make those decisions. But if we're gonna get the entire city council up to speed on all that expertise that's being used, you know, we may want to narrow the number of things that we address so that we can do it well. You know, we heard about lots of people that are working on aging issues as well. You know, to get into those, do we hand the money over to those other folks but keep investing? Do we get out of that business? What's the best way for us to invest those tax dollars? Nancy?
And Chairman, the only other thing I would like you to consider is that we know from the federal government that early Head Start and Head Start, probably their funding it's already started to some degree, but, that's a federal trend that we probably should also consider when you're looking at that.
It is a federal trend, and then when we look at it, and United Way has just made some really major changes in what they fund, which you have some documentation about. They chose to just give us their last 2 years, but if we want the 3 years before that to see how radical those changes were, we can get them. And the issue is if the major funding is dropping, then how significant is a small amount that we would contribute? Do we let somebody else get into that business, or do we keep putting just a little bit of money in it? So we'll see.
I think that's the flexibility that you get if you moved, either broaden that category or, maybe youth and early development services. And, eliminate the idea that we have to fund some sort of daycare. We can fund, maybe we do. United Way's priorities may change, or other organizations' priorities may change, and needs change in the future. I think giving ourselves instead of tying it specifically to daycare, maybe that's a semantic argument, but I think broadening that category to either early childhood development or incorporating it with youth and early childhood development, to pool all of that money in there, and then we'll decide whether, childcare is a part of that or not at that time, at the time that people are presenting for grant applications.
Okay. Spanish speaking is the last category on our list. The only, again, that was a classification that we went ahead and did, but there's just one program, and that's a community action program that provides a variety of assistance to people, but in particular, it's for Spanish-speaking people so that they can get access to those services. Is that more or less a good description, John? Okay. Is it important for the city to be investing in? There are other entities in town besides just the one. I do that.
Well, I think it is important. My Spanish skills have declined considerably, so I might need some of that assistance too. But there's a large Spanish-speaking population in this community, and it is a priority. All of these other funding that we're talking about, all of these other grants, all these other organizations deal largely with Spanish-speaking populations too. So yeah, I do think that's a priority. It's something that if it becomes not a priority, I mean, it's never going to become not a priority because we don't have Spanish speaking. But if there's somebody that's filling in, then it's going to lose out on youth and social services grant funding to something that, that's more pressing. So I have no problem leaving that in the category.
Thoughts? Councilwoman?
You see, I don't know if Spanish speaking is the right place to put it in, because it just denotes one specific group and it singles it out. And I think that what community action does reaches out much further than just Spanish speaking individuals. I think that although this is particularly for that program, I think that we are missing out on the rich variety that we have in our community. I just recently had a conversation with some leaders of this community, and actually I had a visit from Washington, D.C. this last week to talk about initiatives for diversity in this community. And I was mentioning the fact that, yes, the Latino population is the largest growing population that we have in this city. However, we should not forget that we also have a very rich Indian culture. We have a very rich Vietnamese culture. And I think that putting it as Spanish speaking just, that goes, I think, more under the basic needs area, because what this service really does, and correct me if I'm wrong, is supporting families that are seeking basic needs. And putting it under Spanish speaking just concerns me a little bit.
As I recall, it was more than just emergency aid, however. it was tax assistance.
If I could comment on that, the origin of the Latino Family Development Initiative came from the city itself. Recognizing that there were groups of Spanish-speaking, new Latino immigrants coming into the community. They were starting to live in an area which is now Scott, but was at the old Lafayette store over in East Topeka. And there was a concern that they did not have access to services and that there was no contact with them from any of the social service agencies because of where we were located in East Topeka. And because we had started some initiatives for the Latino population, the city came to us and said, would you take on what under the original term was a family development program? And that we would connect with the schools, we would connect with families, and there were certain specifications at that point that were laid out. One was to pay attention to language, so that that population became more comfortable with speaking English and able to function within the community. The other was to pay attention to employment, and to assist those families as they try to seek employment. In time, we have added to that, we have a very strong tax initiative program, income tax assistance. We still work with those kids in the schools. We still work with those families. Language instruction is important, but it was really a multi-purpose approach to targeting that population. Now, I agree with you that there are other populations that could benefit from it. What I think we brought to the table is we had people who were bilingual, who could assist the folks who came in, because the folks who came in were speaking predominantly Spanish and were somewhat separated from the community because of that. I mean, the task was to try to integrate those folks into the community, to culturize them so that they could live here and work here and become productive people. So that still is the current, I mean, the Latino population from our point of view is the fastest growing population of services that we have. They're pretty close to taking over in numbers.
In a way, then, would this be perhaps similar to the classification that we had for mental health / neighborhood? In, if you reverse that, it would be a neighborhood / special needs, that there was a special need discovered or defined in that East Topeka neighborhood where your offices are that was unmet by anybody else, that you should
Correct.
develop,
Yeah.
similar to Breakthrough providing those core services for the residents, particularly in that area of central Topeka, around, not exclusively in your case, but right around where the Breakthrough clubhouse and so on are. That's what you're
Yeah.
describing.
Right, and what had happened is, in the case of Latino, the majority, what we get from the city is very small. I mean, it's a very small amount that comes to support that program. It has been reduced over the years, as in many instances, many of the programs have been reduced. The major funding for us was JJA, Juvenile Justice Authority money, prevention money that supported the Latino Family Program for a number of years. And under the current state administration, prevention money has been removed. So we lost that funding. We lost the prevention funding from the state. Now we're relying upon a combination of what the city gives us and federal money that we are able to get. But the momentum and the incentive for the Latino population, which Juvenile Justice Authority had for a number of years, is now gone. So any of that funding is pretty much left either to the city or to a block grant coming from the federal government. And at the same time, what I would say is that that population is not only growing, that population is in need of services that
How much are you working with El Centro on this?
We have worked, as a matter of fact, the grant that we got up until 2 years ago was split. We gave El Centro part of the grant that we received from the city. So our contact with El Centro used to be financial. We supported them through a portion of the grant we got from the city. We still have contact with them in terms of accessing the population.
So you're stating that this is a higher need for community action to support, you see a higher need for that?
From my point of view, absolutely. I mean, I think it is the rising need within our particular social service world that it is the Latino or Hispanic population. They are growing very fast. They are becoming an economic factor in East Topeka. They are developing businesses. Their kids are going to school. The culturation needs are terrific for that population. So, yeah, I would say.
And the reason that I'm asking this is because I know that there was a key position in community action that focused specifically on this program, which is no longer there.
That position went away because JJA money went away.
Okay.
What we've done is we've redesigned the program so that we now have a person who is taking on that responsibility. Beto. And we're using the money that comes from the city as well as the community services block grant that community action receives as a community action. But I feel very strongly that the future of, for us at least, is to look at how we can broaden our capacity to serve that population. The whole issue of filing taxes and dealing with the IRS around those kinds of issues is very time consuming and is something that's important. We are involved in the Dreamers program. We've had huge success in getting those kids qualified. Families who are in need of rent and utility assistance, various school issues it's just constant, and it's a very varied set of issues that we're addressing. And we're under capacity. And I have no doubt we're under capacity in terms of being able to address those issues.
Thank you.
And I will add to that, at our new initiative at Avondale East, we're seeing a number of Hispanic, Spanish-speaking people, but also to take into consideration are the number of grandparents that are raising their children, and that is their only language that they know. And so, having to talk to that grandparent, and them not being able to understand English, but having to go to the child to have them understand, and you pray that they're giving you actually what you're saying to the child. We've seen a tremendous, and we're seeing an influx of grandparents raising their grandchildren.
And just to broaden this subject out to get away from the specific agencies, but looking at how this program emerged at first, would you say that such services need to be duplicated and neighborhood-based, or can they be centralized in the community and be effective?
The centralized base is very important. As a matter of fact, one of the reasons we came in under the CDBG was because of neighborhood development. The focus in CDBG on neighborhoods.
Mm-hmm.
Now, we've broadened beyond what the East Topeka neighborhood, but it certainly, I think, has a real advantage if you're located within an area where that population is starting to live, where they're starting to buy houses, rent houses, set up businesses, and so on.
Okay.
I think I'd have to think about that, because certainly if our almost like a floater, maybe.
Okay.
Something that's not necessarily hired by the city, but I know when we did our community resource guide in Spanish, it was a nightmare because of the different dialects of Spanish. So we needed to go with pick one dialect. And that is also a problem that we run into with it too. And I'm sure, John, you run into it.
Yeah.
Been there, done that.
You open up a huge can of worms when you start dealing with it. I think the biggest issue that we faced for a number of years was in the language area, the children learned English faster than the adults did. And the child becomes the spokesperson for the family. That is a very potentially it creates dysfunction. If the kid is the one who represents the family to the community, and therefore the development of adults and so on is a critical issue. That population is, in my opinion, growing leaps and bounds.
It might be something you want to partner with the USD 501 with. I mean, if you want to reach out and partner with them with it.
Well, and what you're describing is that we do have the social service block grant out of the general fund, and then we have the community development block grant money, which is advised by the Community Development Advisory Council, which is representatives of the neighborhoods and a couple of at-large folks. And if I heard you right, the development of the particular program that Community Action's doing that's targeted to, at first, Spanish-speaking residents, incoming residents in East Topeka, was driven out of that neighborhood-based council suggesting that those services were important. Is that correct? Okay. Something for us to keep in mind in terms of a couple of the other issues that kind of are fit into all this is what's the appropriate kind of thing for us to fund? Is it proven services that need long-term support? Those, in my experience, would generally be ones that are 3 years or older, have completed 3 years, or is a role for us to fund startup money or match money for new programs. Because there's been discussion, one of the reasons we're meeting is that some on the council anyway felt that we should be opening up the application process to new agencies. We've seen that done before. I've seen it done in the last 15 years, and it was kind of a mess. The agencies that had, not that there weren't programs and not that there's always a need for pruning, but there were lots of neighborhood-based, untested programs that applied and got funding, and it took away from the more performance-tested agencies, and many of those agencies that were funded during about a 2-year period didn't survive even, or the programs that started. You were around, Michelle, correct me, those that were around, but it was well-intentioned, but we lost a lot of dollars when it happened. So it sounds like this investment perhaps went well. Do you want to, even since we're at this junction, we've got some time still in this first meeting, talk about that issue of program-based funding only, new programs versus proven programs and match money? Any reactions on those?
I'm a huge believer on match funding because it allows the organizations to have funding leverages. As a grant writer, I tell you, and I think that, of course, you understand this as well, what grantors are looking for are partnerships. And what grantors are looking for is organizations that do have a proven track record, but that are also able to collaborate with other social services within the community to make a better impact for their dollars. And I think that if we're seriously considering our funding tactic, I think that this would be a wise consideration to have.
Match money?
Match money. Yes, you heard match money and you heard,
Performance tested and collaboration.
exactly.
And you can't have the
Barbara.
performance testing unless you've been around for a little while, at least the
Correct.
agency, maybe not the program, but the agency.
Mhm.
Nathan?
thoughts on that? New programs, new agencies?
Well, I think if we come out and say, you know, we're only going to fund something that's been around for 3 years, or, you know, that has some sort of established foundation, we're limiting the potential, you know, to get the best return on, you know, on what we're doing, in that some of these programs that are startup programs or that are new programs, these new ideas can be good ideas. I agree that some of them fail, but I think that decision-making process should be at a grant application level, not at a policy level. So that we're looking at, you know, if somebody comes up with a new proposal, a new idea, and, you know, the people evaluating the grants, which are probably going to be us, say, how come nobody ever thought of that? It's a brilliant idea. You know, I don't think we should be restricted from moving in that direction just because they haven't done it for 3 years. You know, I agree that that's certainly a criteria. You know, the ability to operate and the ability to get results is a criteria in the grant process, in the process of deciding grant monies. I don't think it should be a determining criteria or an eliminating. It should be a considered criteria.
And the only reason I agree with you, the first comment, that the reaction that I have to this is, we have to set the policy, because if not, anybody can apply for anything. So it is our role to decide what we want to have as parameters, because if not, like Karen said, it opens up the door for anybody to come through the door with a brilliant idea that they are not able to sustain. And I would completely agree with you if we were a multi-million-dollar foundation that had risk funds to be able to invest. But the dollars that we have are dollars from our constituents, that we have to be very wise on how we invest them. And our constituents, we have to make sure that we're serving them correctly. And that's the only place where we differ. I wholeheartedly agree with you. Were we a corporation that had investment funds and capacity building funds? Absolutely. For us to go ahead and look at all the grants and you come in as a new person, I would say, you know what, bring me your money and show me how you're gonna, bring me your idea, show me how you're gonna use it. But we're talking about $344,000 here of constituent dollars. And I think that we owe our constituency setting proper policies and ensuring that the dollars that they are giving onto us, especially knowing that a lot of cities don't even have social service funds. That if we are making sure that we believe in our social services, which I believe in, obviously, that we are making wise use of those dollars and that we're vetting the candidates that are applying for these grants.
I think that's a perfectly legitimate criticism, and it's a perfectly valid point. I think where we differ is, you know, on weighing the value of, you know, the new organization coming in and presenting the new plan. And I think that's something that we should weigh, you know, and I completely understand the argument against this, you know, but I'm okay with weighing that at the grant level. If somebody can, because it is a consideration, you know, the experience that you have implementing, you know, your plan or your program is definitely, I mean, that's a major part of the criteria. If somebody has a new idea and can present in a convincing enough fashion that they're going to be able to overcome any of those, you know, those barriers to entry for their program, if they can convince us or convince, you know, whoever in the future is determining the grant allocations, if they can convince us, I don't think that a policy hurdle should prevent them from doing that. And but I understand the, you know, the reluctance to do that, because we don't know who's going to be making the grant decisions in perpetuity. So I understand that objection. I would value, you know, the idea of opening up the process as wide as we can over that, and that's just a difference of, you know, of opinion on that portion. But But I certainly understand that concern. So I guess that leaves it up to Karen.
Councilwoman, in your wisdom.
Well, something that I've seen, and I'm open for discussion actually from you all as well as others, is that it's a lot easier to get new money, to get money for a new program or to try out something new than it is to get that long-term sustainable money. We've had some conversations about examples where people started programs because there was a grant and an initiative from somewhere and it was a good idea, so they got it started. And then down the line, that money to sustain it was harder to come by. And that's why even each time the city has hacked away at whatever it's providing, people have continued applying and continued getting whatever they could. And so for me, I want high performance with those tax dollars, as you've said. I mean, good and responsible performance as well as good as solid outcomes, defined and proven outcomes, or demonstrated outcomes. But I also look at what our role is, and if, given the fact that we do change council people, whether we choose to have a committee to help us or whether the council does it on their own, to kind of narrow the parameters that the city is looking at so that the parameters we've set are as strong and as safe, I don't know what the right word would be, safe as possible, so that there really is a good bang for that buck, and we are providing core funding. To me, core funding, which often is match money, generally not providing the whole program. I know that sometimes just the fact that the city is a player is sort of a good housekeeping seal of approval. It means that the city values it, and it's very helpful for agencies to have some small amount of money and to show that it's sustained year after year in order to attract the other money, whether it's for the ongoing program or whether it's for that special new, you've got, for instance, just because we were talking about Community Actions Program, they've got all these programs for all these families, and then when there's a need for a Spanish-speaking initiative, they've got a strong enough base with multiple funding sources so that they're a viable candidate. And again, just as an example, because everybody in this room does the same thing, I imagine, so that they're a strong, viable candidate with money they can rely on. Something that I've worried about with our funding at the city, we've gone ahead and been steady with the funding, maybe chipped at it, or our predecessors as council people, but the council has not been evaluating that funding to make shifts, and it seems like it's, we're here because maybe it's time to do that. But I know how important it is for an agency to build a program to be able to count on money year after year for those core things. So I don't want us to lose that. It's not that I don't want us to open it up to other agencies. It's really never been closed, but there's never in a long time been a process where the city affirmatively went out to solicit, not in 10 years or so. So there's only so much money, as one or both of you pointed out, and so maybe in fact it's done by very specific guidelines rather than restrictions on what we would fund. I also do think about the fact that it's a favor to everybody in the community to be real clear on that so people don't apply if they're really not going to be competitive, and also so that if we're really only likely to fund 12 agencies or 20 agencies, we don't have 40 applications. That's a huge process to go through, too, in terms of the amount of time that our colleagues would need to take on the process. So those aren't conclusive, but those are some of the thoughts that I have on it. To me, a strong role for us is, if we're going to do it, to say these are core services that are needed.
I guess my only difference with that would be that if you look through this list of the services that we fund, and of all the people in the audience, and we are the primary funder of probably none of these. We are supplemental funds. We are in a lot of cases startup funds for programs that come from existing groups who are trying new things, and you know, that's about the amount of money that we're providing for a lot of these groups, which is why, and I understand, you know, we have a very, very real and very significant responsibility to make sure that these funds are spent as well as possible, and I am fine with being held accountable for that. All of us do get held accountable for that. You know, our names are the ones that are going to be in the paper and on a ballot box. So we have that direct accountability for that, but which I'm okay with. I'm also okay with the idea that, you know, since we aren't the primary funder of most of these organizations, and since we are essentially, you know, providing seed money or, you know, supplemental funds to a lot of these programs, I'm okay with taking more chances on that, as long as they're, I say taking more chances reluctantly, because I think, you know, I think we take more chances at the grant evaluation level, instead of saying, and it very well may be the case that whoever's on that, you know, whoever's deciding how that money is allocated says none of these new programs, new organizations, new ideas, none of these are as viable as our existing population. It also makes our existing population of grantees more accountable, because maybe somebody does something or can do something, you know, more efficiently or better than they're doing, and you open that up to that with the understanding that these are not primary funds. We're not funding primary things. We are funding, you know, at a supplemental level. That's my only objection to characterizing it that way.
Madam Chairman, may I address that for just a moment? We are very small agencies, the majority of people that are in this room.
Mm-hmm.
And while it's a very small amount of money, it can be a very large impact to that organization. And if you do not believe me, watch for the impact that the county cutting social services by $100,000 and aging by $80,000 is going to make to some of these agencies. And while, again, it's a very small amount to you all, it is a very large amount to many of these, and sometimes can be the tipping point as to whether that program will stay alive, that staff person will be there, that child can be helped. So while I agree with you 100% that the majority of your funding is not 100% for us, it makes up a great, with many of the nonprofits here, it makes up a great deal of our existence as you see it today.
It
Thanks.
also can be multiplied because it is managed, and it shows a great deal of support on a community level that does attract other dollars. So it can bring dollars into the community on many different levels.
One more comment?
Yeah, just really quick, and the important thing is it's fairly unrestricted money. Most of the other monies that organizations like ours get is very, very clear what you can use the money for, and sometimes it just seems impossible to even run an organization if there's not money that's a little bit more free-floating that can be used to fill the gaps that are maybe not that large, but very necessary to fill, so.
Thank you for that point as well. Let's wrap up for today. Colleagues, what I am hearing in terms of our mission for today, which was to look at priorities and categories to fund, is that it appears that there is consensus that all of them are important.
Mm-hmm.
And that the members, this is again, we can change this before we have our 5th meeting or however many we take as we finalize this, but as a takeaway from today, I think what I'm hearing is that this group feels that all of the areas are important, and so that perhaps the process of that we're going to talk about in the upcoming meetings would be more of a critical element for us to work on than simply
trying to cut anybody out as a priority or any purpose. Would that be?
I think that's fair.
Okay, so that at this point, all of these would go forward. Out of the categories that we named, there was discussion of, we may or may not have subcategories when it goes out, but is there a sense that we should combine youth and daycare to being youth and early childhood at this point for categories?
I would support that.
So would I.
Okay, Jenny? Okay,
Just a consensus.
I
I
was
don't know if
just,
we can take a vote in the work session, can we?
we're in a committee meeting, we can, but I was looking for just some consensus at this
Okay.
point, sort of straw poll style. I don't really want anything to go out of this meeting as a final vote yet, when we're still working on process. Next meeting, we are due to be addressing the issues of performance criteria and monitoring. And what I would like to double check with you is what you all as committee members would like to have. We do have notebooks, which actually the application forms that people used last year did not all match. There were pretty much 2 different formats, but they had in them far more performance criteria than I think the council members that had not seen them before realized was in them. We did, Jenny, get, in the course of gathering the data for today, we got United Ways. We've got a couple other, just their processes for how they do the applications and how they review and rank them. What kinds of documents would you like to have for next time? We've got our notebooks. I think we need to do the homework of reviewing the applications that we had and itemizing what performance criteria are already addressed. If you would like to have staff presentations, if you want to stick just with the city, or if you'd like to hear from United Way and the county and the alcohol and drug funds, which are actually the cities also, but are handled by another group. How do you want to handle considering the performance criteria and monitoring?
Good.
Any thoughts on what materials especially that you want us to gather beforehand or presentations to help clarify?
I think that just, the basic starter would be our application process
Okay.
to have on hand on a blank.
Rochelle, are there actually 2 forms? Did you use all of just one for CDBG?
On my map, we fund the CDBG and some general fund.
Uh-huh.
They all use the same application, same reporting forms. But I think on the contribution to agency side, there's a different application.
Yeah, we tried to merge them a couple of years back to have the same application, but the federal government needs more detail than we actually need on the city side. So we kind of picked the common fields that we both had, but her CDBG application is just much more complicated than the general fund.
But my general fund, they answer to the same CDBG questions, so they're
Uh-huh.
already good now.
Well, could the 2 of you perhaps work together to bring us blanks of each of those and give us a brief presentation about what's in there and why it's in there and how you review it when you get the applications in?
And then there was a third fund, a third applicant was the alcohol and drug.
Right. Now, those don't come to us directly. Those come already advised to us.
Through the alcohol and drug advisory committee, which is
Right.
appointed by the county. But I believe we sent our protocol, did we not, Jenny, to you
Yes.
today? Yes.
I knew we'd gotten one today.
Yeah, but again, that is set up by statute, and I don't know if you all have the statute on the alcohol and drug money, but we can get that to you also.
I want it, if we're focusing on the social service block grants, and the general fund and the CDBG money in particular. So what I'm looking for is those other processes as reference, but we do need particularly the training. Because it could be that what we have is fine in terms of what we're asking for and how we're monitoring. But we wanna make sure that, but if it's not, we wanna at least start with a good understanding of what we're doing today. Well, Pam actually has just taken some fabulous job in Midland, Texas, so do you have somebody else that can do that for us? Okay. All right. Thank you so much, and congratulations across the room. So we'll have our city staff do us a walkthrough on what we're doing, and at least the processes, some basics, fundamentals on what the other ones are, at least for reference. And if we decide we want some presentations from folks on other ways of setting up the criteria, that's what I want to make sure how much you want, because obviously if all we do is look at ours, we won't have any perspective.
Very much so. That's what I would want. I think the most important decision that we're going to make on this process is going to be defining how we evaluate these applications. So I'm fine with public input. I'm fine with staff input on and us bringing our own ideas on what are some of the metrics, what are some of the goals that we're going to look for in applications. Whether it be number of people impacted, or however you want to set up those kind of criteria. But I think that's something that we should discuss and get into, and we should definitely get public comment on that as well.
Since you bring that up, and since we have this great room full of people here, gberghart@topeka.org is Ginny's email address. You all have experience with our format already. If there are thoughts that you could share with us in advance of the meeting that Ginny could then consolidate for us, we're really eager to hear them. You all get funding from other sources as well, so your perspective is good as far as performance criteria that are meaningful, outcomes criteria that are meaningful, and processes. We would be happy to have comments from you. Signed is preferable so that we can come back and ask you more questions. I'm not sure there's anything any of you would say that you'd feel like you needed to send anonymously, but if you did, that's okay. We just want to make it better, and we want to make it meaningful, and we really appreciate having you all here today. I'm glad that our pace was such that we could take your input and some comments along the way. We've got 3 minutes if anybody has a public comment for the good of the order before we break. Sam?
Just have one on the Spanish section. As the minority component of our population is growing and becoming more economically significant, and it is, a couple of things. One, we have to keep an eye on immigration reform. If that changes, it could change the priorities of the people that are arriving here considerably. And also, we might consider asking or getting input from some other cities that have a much more serious impact from this. And what I'm thinking of is I spent a year down in West Palm Beach, where they have a Hispanic community that dwarfs ours. And they have a single school up on North Military Trail that teaches all different aspects of acclimating, including driving, which they need desperately. You should see them arrive at that school every day. They were jumping curbs and parking 3 deep, and it's just incredible. But, and a path to citizenship school. And I would be very surprised if there aren't federal grants and matching funds available for this. But get some input from the community as to what they want. It was amazing how, particularly the elder people, were finding the time to take these classes.
Thanks, and since I know that you're not one of the agency directors, you might want to introduce yourself.
Oh, tonight I'm just a citizen because I forgot my button. But normally I'm just an observer for the League of Women Voters.
And your name is?
Sam Hartman.
and that's something, not only a great comment, but for us to be considering as a committee to recommend to the council, whether we want to take on as a council that forward thinking and building programs to anticipate needs or best practices. We lean on CRC for that to a great extent, yet we don't ever ask them to do anything. They just step up and do what they think is important, and it turns out fine. So
Get up on our desk and back.
they're working really hard, but I mean, if there were some things that we wanted someone to look into, we can consider how we would put that in this process as well. Anything else? Thank you so much. We will reconvene on December 9th from 3 to 5 in this room,
And I will
talking
be
about
late again.
performance criteria and monitoring. What?
I will be late again. I have a standing meeting at 3 o'clock. I told you guys last time that I had a
No, we
standing 3
wouldn't-
o'clock
No, I
meeting.
didn't understand that. I thought it was a standing